I really want to talk about is talking more focused on the issue of what do you do now? We've talked about the presence of disparities now for years, decades, and now the question is what do you do? And particularly, what do you do in turbulent times? And so I love this diagram because, or cartoon, because it raises the issue that advancing disparities in turbulent times requires more so leadership and embracing the adaptive challenges. How many folks have heard of the term the adaptive challenge? A few? Okay. So let me give you a quick example. How many folks are following what's happening with General Motors in the United States? Great, almost everyone. Good. So my question to you is this. Would General Motors could continue on as it was if we just gave them more money? I see the audio guy in the back like, no way. Okay, so clearly they couldn't stay the same, and they needed to change. So the question is, why didn't they change before? They didn't have to. It's hard. It's challenging. And you have to face these very tough issues of how do we make cars that are more efficient? How do we make cars that meet the demand of the American public, et cetera? These are what we call the adaptive questions. And usually what will happen in times of turbulence is that people will address the technical fix, which is give them more money, but not actually push them to address the more challenging adaptive challenge. And the truth is, GM needed to change years ago. And through the insight of our president and his leadership team, he's figured out how to use the current environment as a way to really help reshape General Motors, not get rid of General Motors, but reshape them and actually force them to address some of the adaptive challenges that they have to talk about. So let me use that to kind of jump straight to healthcare and reframing the challenge around disparities. Because the issue is, whenever there's tough times that we're in now, there's the loss of revenue. And the first reaction is us cutting budgets, cutting staff, because we need to stabilize the situation, slowing of the economy, and the reaction is that we need to hunker down. Let's wait this out. Kind of that GM and mentality. If you just give us a little more cash and we'll wait this out, we'll come out of it and we can just keep doing what we were doing. But instead, really the adaptive challenges, particularly around healthcare and health disparities, are how do we begin to contain costs? How do we better improve access without increasing costs? How do we improve the quality of care? How do we look at patient safety issues? And so in crisis leadership, clearly you have to stabilize the situation, you're trying to limit the damage, you're trying to buy time, but really the adaptive work is trying to figure out how do you work to solve the real underlying issues. And this is where, for the disparities piece, I think it's critical because there's some deep, deep underlying issues we have not begun to grapple with. Things like institutional racism, things like why minorities have recurrent appearances in the emergency room, things like why some young teenage moms won't breastfeed. What is actually going on behind that? And the temptation for us, typically, is to stay in the emergency phase, for sort of kind of stabilize the situation and not move to those tougher questions. So my challenge for you is to think about how do we use this challenging time to really push us to dig down, to figure out what are those really challenging issues that we need to get to around disparities. So more specifically, instead of focusing on just the technical challenges and quick fixes, pushing us to think about cost containment, hospital readmission rates for minorities and how that impacts disparities. Looking at disparities in access to care. As Amy mentioned this morning, we have 28,000 people in our Commonwealth that now don't have healthcare access. And how do we go about addressing that? Clearly, for some of you that are watching the news, know that immigration issues is sort of the third rail. So that is an adaptive challenge. So how do we push ourselves to figure out how do we address and improve the health of those populations? Issues around quality of care, language barriers, issues of trust. Why is it that people don't trust coming into certain institutions? Issues around patient safety, interpretive services. And so the challenge for you is keeping the attention of the public, keeping all of our attention on the ongoing adaptive work, turning this current disequilibrium into something productive. How can we really use this to get to the tough questions? And then finding solutions, and I'll talk a little bit more about this around widespread experimentation, and that there's clearly no authoritative expert. Don't let anyone fool you to say that there's anyone in Washington or anyone at Mass General or at Harvard that has an answer for this. Between you and I think the answer is actually in the community.